I'm ready. Good. Okay, Kathleen, we're going to do some tests as you're lying at a 45-degree angle. Is it okay if I lay you back?
Sure.
Okay, head back. One thing that I notice I lay her back is that her anterior to lateral is 2 to 1. Okay. So Kathleen, I'm going to listen to your chest. Good, and I'm going to lift this up just a little bit. Would that be okay? Or you can lift your shirt up. Good, and I'll be listening here. And just arms loosely to the side, please. Good, and all fields are clear to auscultation. I'm going to move right into abdomen, if it's okay with you. I'll just pull this just down a little bit to see the umbilicus, and just leave your arms loosely at the side. So on external exam, Kathleen's abdomen is flat, scattered nevi, good muscle tone. Again, breathing appears normal, no distended abdominal veins. Kathleen, I'm going to have you with just your head, do like a little sit-up, and there is no separation of muscles here. And so I'm gonna listen next, okay? Mm-hmm. Starting with the right lower quadrant. Good, and she has gastric noises in all 4 fields. So next, I'm just going to percuss. First, I'm going to start by finding the liver here. So from the costal down. So her liver borders, I would say, are approximately 3 to 4 inches across here. Um, 5 centimeters. And I'm going to move over here to percuss the spleen. So about mid-clavicular left side. Some splenic dullness noted here. And I'm just going to percuss. Next, I'm going to just do some light palpation. If anything's tender, let me know, okay? Mm-hmm. Good. Anything tender? No? Okay. Good. Nothing tender. Good. Doing okay there? Yeah, good. I'm going to feel a little bit more deeply, and you're going to feel my hand come up underneath you as I try to feel your kidneys too, okay? and the gastric air bubble is right here on the left, kind of lower quadrant here. And we feel the umbilicus too. And so no hernias, no masses. Good. Soft, non-distended. Okay. I want to listen. First, I'm going to feel for the aortic pulsations. On the left. And so I can palpate the aorta. I'm going to listen for them as well. Turn the bell. Good, and then iliac. Good, and renal, a little bit lower. Good. I'm going to listen to a couple of things up high as well, okay? And I'll just pull this up for you while we're not using that. I'm checking for bruits with the bell, temporal. And for the carotid, I'm going to have you hold your breath for me. Hold breath in. No bruits. And on the other side. Good, and one more time, I'll ask you to hold your breath. And go ahead and breathe normally, no bruits. I'm going to check for the abdominal reflex. I'll have you expose your abdomen. And it'll maybe tickle more, but and straight up here. And you can see the reflex here. I'm going to pull this down just a little bit. And a little reflex there. And pull that up. All right, so next, we're going to start with the heart. So I'm going to have you turn just a bit away from me and check for the jugular pulse. No jugular vein distension, but the jugular pulsation is noted, and I'll check to make sure that it's a vein and not an artery. So not palpable, so confirmed that it is a vein. So we're just going to check the pressure, and again, I'll have you just keep looking away from me. So I'll find the sternal notch, angle of Louis, the highest point of her distension, or I'm sorry, pulsation. So her pulse pressure is about 2.5 centimeters of water. Okay. Next, I'm going to listen to some heart sounds, okay? Diaphragm first, starting with the aorta, on the clavicle, 2 intercostal spaces down. Good, and pulmonic. Good, S1 and S2 noted. I'm going to come down to Erb's point, one clavicle space down. Good, S1 and S2 noted. Now the next one, Kathleen, I might have this come down and I'll listen from underneath. I'm going to look for the apical pulse here. And you can see her apical pulse right here. So I'm going to listen to the tricuspid and then the apex here. Good. No, no S3, no S4, and apical pulse. Good, S1 and S2, no splitting. Kathleen, what I might have you do is turn slightly to your left, and I'll see if I can get it to be a little bit louder. Louder. I don't know. Yeah, that's perfect. And I'll just, oops, yeah, right in here. Brings it closer to the surface so that I can hear it. Good, and it's good. And go ahead and lay back. Good. I'm going to listen for murmurs with the bell. Kathleen does not have any thrills or heaves or lifts when she breathes. Good, and murmur starting from the aortic. And pulmonic. Good. No murmurs. Going down to Erb's point. Good. No murmurs. I'm going to come down a little bit here, and then I'll move underneath for apex. No tricuspid murmurs. S1 and S2 noted. No S3. I'm going to come from the bottom. No murmurs. I'm going to keep listening down for the aorta, iliac, and femoral. Good, no murmurs. Go ahead and loosen your hands up on the side. And no murmurs on the renal or iliac. Okay, so I'm going to lay you back a little bit more. We're going to get started on hips. Let's see here, back just a little bit. May I uncover you from the bottom? Sure. All right, and I'm going to have you raise your right leg at an angle, just like kind of straight up. Good range of motion. Same thing here. Good. Now I'm going to feel the femoral pulses while you're exposed here. I'm sorry. Good. And femoral pulses are easily palpable. I'm going to listen. Good, same, and again on this side here. And I'm sorry, I know it tickles. So she has good strong pulses. She's a +2. Good. And auscultated as well. I'm gonna have you take your right knee to your chest. Good, same. And left knee to your chest. Good. Now I'm gonna have you bend your right leg with your foot here. Take on the, yep. And then rotate it in. Good. And then same thing with that one. And rotate it in. And then put this ankle on this one and kind of rotate your hip out. Yeah, and kind of jut your hip out, external rotation, and then same thing with this one here. Good, and so she's good there. All right, and I'm gonna sit you up normal. There you go. And I'm gonna sit you up. Okay, so I'm gonna have you let your feet drop, and I'm just gonna expose just your legs. We know that you can bend your knee because we've seen that. So why don't you take your right heel and run it down your left shin and back. Good, and then to the other side, same, top to bottom. Good, and go ahead and let them drop. So Kathleen's musculature is normal. There's no edema. Good pedal pulses, they're +2. Go ahead and push on my hands with just your feet. Like push up on them. Yeah, just like that. And good, and down. Good, and I'm just gonna feel your joints here. Good. Any of that tender? I see you laughing. And so the toes are over. All right. And so no inflamed joints. Good. And the lateral and medial malleolus. Good. Any problems there?
No.
Good. Okay. Hair is present. The skin is normal texture, not too shiny. She's warm. I'm going to feel behind for your popliteal pulse on the right. Good. Present, as expected, a +2. And on the left, as expected, a +2. As I palpate the knee joints, no effusions, no crepitus, any tenderness?
No.
Good. Okay. All right. I'm going to do some reflexes on the bottom of your feet here. So it might tickle. So watching for the toes. A tickle?
Mm-hmm.
And so you see her toes, dorsiflex, yep. And same thing here. And her toes come in. All right. And we'll do let's do this first. Let's check for clonus. Good, so no clonus on the left. And no clonus on the right, not tender. I'm gonna check some reflexes on the Achilles. And go ahead and relax. Good. Start up here, and go ahead and relax the foot here. And you can see the reflex here. Next, I'm going to move to patellar reflexes. Just under the patella. On the right. Good, and you can see the reflex here. and again, the reflex there. Okay. Next, let's do the brachioradial. And then we'll watch for a little reflex up here. And it's present. I'm gonna move these up just a little bit. And we'll watch for the reflex here. And you see the reflex there. Next, the bicep. You can go ahead and relax. Yeah. Relax real good. And you saw the reflex there. I'm gonna relax real good. There we go. And the reflex there. So next we're gonna do the tendon reflexes. I'm gonna start with the right one. I'll just have you kind of give me a little, yep, right there. And the tricep right here. And we're watching for the reflex here. Good. And same thing out here. And you saw the reflex there. I want to do a test where I'm going to touch you in a couple places, and you're going to tell me, am I touching you with one object or two? And those objects are going to feel the same as the chart before. So, okay, yeah. I'm going to have you close your eyes for me, and you'll tell me, am I touching you with one or two? Two. One. Two. One. Good. And while your eyes are still closed, tell me where I'm touching you. Arm. Which one? Right. Left foot. Left hand. Right foot. And you can go ahead and open. Verbalizing gag reflex. What next thing I'm going to have you do is close your eyes, and you tell me if I move your toe up or down, okay? In space. Up. Good. Up. Yep, good. All right, Kathleen, that is all I have for you today. Do you have any questions for me?
No.
Okay, thank you very much for your time. Thank you.